The topic of our current session is, of course, one that has been on all of our minds for many, many months. COVID-19 has touched everyone's lives in myriad ways. Over the next less than, probably closer to 50 minutes now, our panelists will explore the gendered aspects of public health emergencies and pandemics, and we'll discuss how WPS can inform our responses to global crises like COVID-19. Please note that remarks made in today's program are on the record, and we would like to remind our speakers to keep their presentations to a maximum of 10 minutes now. So we have ample time, or we may not have ample time at all, for questions and discussions. Today's conference is a public webinar, which means there are individuals joining the event virtually who are not visible to the conference panelists and participants. Participants are welcome to keep their camera off or on during conference proceedings. Audience members joining virtually are encouraged to submit questions or comments at any time throughout the session through the Q&A window. Virtual participants can also provide a live comment or question by using the raise hand function, which is accessible from the participants tab. If you raise your virtual hand, please wait for the moderator to call on you. Once called on, Pacific Forum staff will enable your microphone, so please be ready to unmute yourself and state your name and affiliation before making a brief question or comment. And as a true hybrid conference, we would also like to hear from our audience members who are here with us today at the Queen Kapiolani Hotel in Waikiki. So for our in-person participants, if you would like to provide a question or comment during the Q&A portion, please raise your hand or tip your name placard and wait to be called on by the moderator before using the microphone that will be handed to you or placed on your table to speak. I will now introduce your moderator for this session, Dr. Jenny Klugman, Managing Director at the Georgetown Institute of Women, Peace, and Security. A trained economist, she holds a PhD in economics from the Australian National University and postgraduate degrees in both law and development economics from the University of Oxford, where she was a Rhodes Scholar. Prior to her current position, she was Director of Gender and Development at the World Bank, Fellow at the Kennedy School of Government's Women in Public Policy program at Harvard University, and Director and lead author of 3 global human development reports published by the UN Development Program. Among her numerous recognitions, Dr. Klugman was included in Apolitical's 2018 and 2019 lists of the world's 100 most influential people in gender policy. Dr. Klugman, over to you.
Thanks, Ariel. Thank you, Ariel. And thanks very much to the Pacific Forum and the Indo-Pacific Command for organizing this excellent series of discussions that I'm very pleased to join today. Turning to today's topic, as the global death toll passes 4.3 million people, COVID is also disrupting the daily lives and future prospects of billions of people. The pandemic, I need not remind you, has disrupted economic activity all around the world, jeopardizing and even reversing decades of progress on poverty reduction and development. The IMF estimates that the decline in GDP last year of more than 4% is the largest drop since the Second World War. Global working hour losses in 2020 will quadruple those in the 2009 financial crisis. But while the crisis is widespread, the repercussions remain massively unequal, exposing and worsening existing disparities. People in poor and minority communities, informal workers, and those living in conflict-affected situations have been especially hard hit. We have also seen the exacerbation of gender gaps. Women face larger challenges on several fronts, including juggling paid jobs and unpaid care work, and worsening threats to safety at a time when access to vital services may also be constrained. These challenges are, of course, interrelated. For example, when access to childcare is unavailable, gender norms continue to put the bulk of the burden of household responsibilities on women, perpetuating their exclusion from paid work. Women who lack financial autonomy and economic security are less able to leave abusive relationships in the home. And women from minority groups, those from poor and fragile communities, and those working informally all face additional challenges that compound gender equality. To help set the scene, I just wanted to briefly highlight some results of analysis that we did using the global Women, Peace and Security Index that we publish at Georgetown University jointly with colleagues from the Peace Research Institute of Oslo. And what we do in this report, which is forthcoming again this fall in October, is rank some 170 countries on the basis of their performance of women's inclusion, justice, and security. And what we found when we looked at the correlation with measures of exposure to pandemic risk, here measured by the Inform Index, is that there is indeed a close correlation, and that countries that perform better on the WPS index tend to be better prepared to face and absorb the impacts of COVID, and vice versa. In the next index report, which we're launching, as I mentioned, in a couple of months, we explore in greater depth these multiple crises. And of course, I was therefore very happy to accept the invitation to moderate this panel. And I'm hoping today that we can look as well at the policy responses and how these have accounted for compounding disadvantages and the global goal of leaving no one behind. So with that, let's turn to our august panel, which I'm sure will bring important insights to the discussion. We're a bit constrained now on time. Each panelist will briefly present up to 10 minutes. If we have time for discussion, we will allow for that. Otherwise, please do feel free to share questions in the chat, and we'll save those and points and observations that you raise and use those to inform kind of future discussions and research. So turning to our first panelist, and I'll introduce each of them in turn. Major Camille Effler is currently affiliated with the Uniformed Services University's Center for Global Health Engagement, and she's the Global Health Security Program Lead. She spent the previous 3 years in the Indo-Pacific Surgeon's Office as the Branch Chief for Global Health Engagement and the Gender Advisor to the Command Surgeon. Major Effler holds a doctorate in veterinary medicine and completed a postdoc focused on global health at Johns Hopkins. Major Effler, we're looking forward to your remarks about the gendered impacts of the pandemic related to public health, as well as ways to move forward. Over to you. Thank you.
Thank you. So just a quick standard disclaimer, the opinions are my own and do not necessarily reflect the official policy or position of USU or the Department of Defense. Given kind of our short timeline and wanting to leave some time for discussion, I'll curtail a few of my remarks, and we'll focus broadly on COVID and gender equality from a global health view, as well as touch on just the importance of gender perspective in our preparedness and response activities for health security threats, particularly why that's important for the defense sector. So I'd like to just talk about two important gendered impacts from COVID-19 relating to public health. And first, I'd like to talk about the global health workforce, which truly is delivered by women and led by men, to quote the 2019 WHO report by that same name. This WHO pre-COVID gender analysis of the health workforce revealed that 70% of the health and social care workforce is women, and they deliver care to around 5 billion people. Despite some progress, women in this workforce are largely in lower status and lower paid jobs, and they hold only 25% of senior roles, having unequal access to decision making. And it is this predominantly female workforce that is facing COVID-19 head on. Women are on the front lines, more likely to be first-line health workers, and they're often under-resourced and relying on personal protective equipment that's designed for men. And all of this leaves them with an increased exposure to the virus. However, given their frontline interaction with communities, women really are a wealth of firsthand knowledge, and they can assist all of us in identifying gaps as well as local solutions, which will ultimately allow us to save lives, times, and resources. If we can only shift the dynamics and bring more women into leadership roles, and also ensure that we have consistent, meaningful, and active participation and inclusion of women in the planning and decision-making processes. So Women in Global Health, or WGH, they've published their 5 asks for gender responsive global health security, with number 1 being include women in global health security decision-making structures and public discourse. WGH found that as of February 2020, for every 3 men that were quoted in media coverage of COVID-19 outbreak, only 1 woman was quoted. And so to assist the media and others to leverage the wealth of women's expertise, they put together a roster of women health security experts drawn from all over the world, representing a diverse group of talented women. And this is part of their Operation 50/50, and they accept nominations on a rolling basis if you're interested in nominating a colleague or yourself. I think it's an excellent idea, and one that maybe the traditional security sector could also take note of as we look to kind of empower and leverage more of the women's expertise. The second gendered impact that I'd like to discuss is related to protection. Prior to COVID-19, violence against women, particularly intimate partner violence and sexual violence, was already a major public health problem, especially within the Indo-Pacific region. Violence against women, as has been noted, only tends to increase during every type of emergency, and pandemic and outbreaks are no exception. In fact, many of the measures that are deemed necessary to control the spread of the disease can actually inadvertently make things difficult for women. So things like restriction of movements, closure of businesses and services, decreased social interaction, all of these can isolate survivors with their abusers and decrease access to the resources and escape mechanisms. So where shelters, helplines, and other support services exist, we need to be ensuring that those are designated as essential services. Measures to protect women and girls from violence should be considered a standard part of government response to the pandemic, and they need to be included in our preparedness planning. This also requires consideration on how to adapt to an infectious disease environment when we're trying to provide those safe spaces and those resources. Just in looking across the region, I found that in Timor-Leste, which has some of the highest rates of gender-based violence in the world, the Australian government has a program called the Noblin program that started early in the COVID-19 pandemic to inform its partners about COVID-19 transmission and prevention, and identified strategies to mitigate the impact on COVID on shelters and other services. They actually drafted guidance in partnership with the Ministry of Social Solidarity on receiving clients during the crisis, and they even established a new reception center for monitoring all new shelter clients during a 14-day quarantine period. And it's really early measures like this that can save lives, and it's critical that these protection issues are included in preparedness activities, including in exercises. I think it's clear to everyone here that health security threats require a gender perspective in the preparedness and response, but why is that important to the defense sector? So within the US, our national security strategy and several subordinate national strategies have recognized the multifaceted impacts that threats to global health security have on national, regional, and global stability, security, and autonomy. The COVID-19 pandemic has clearly illustrated the impact of infectious disease threats, in particular, not only having a tremendous human toll, but also having an unprecedented operational impact to defense missions. Unfortunately, viruses don't respect international borders, and they can spread quickly around the world, as we've all seen. And that really makes a disease threat anywhere a disease threat everywhere. And so it's in our collective security interest to bolster efforts to prevent, detect, and respond to infectious disease threats as early as possible. And doing this really requires a whole of society approach and leveraging the expertise and abilities of women. Taking a gender blind or gender neutral approach weakens our preparedness and response efforts and could further exacerbate stability and security implications. So while combating an infectious disease is rarely thought of as a traditional military mission, the defense sector does bring critical and unique pandemic preparedness and response capabilities to bear in support of our civilian leadership. So by continuing our collective work of building gender competent defense and security forces in the region, we can ensure our support when called upon by civil authorities is actually gender responsive. COVID-19 has exacerbated many gender-related inequities and issues and has globally revealed our inadequacies, with no country, however wealthy or powerful, exempt. COVID-19, threatens the hard-fought gains in gender equality, but I'm personally motivated by the discussions that are taking place around the world, and certainly during this conference. I think we have to capitalize on the momentum and the lessons that we're learning from COVID-19 before the collective memory fades. We must continue to forge into action by taking advantage of the relationships that we've built and by learning from each other and from the women on the front lines around the world. This pandemic is really a call to action, and it's our chance to rebuild global health security on a stronger foundation, one that includes the voices and expertise of half the population. Global health security is more than a health issue. It's a national security, regional security, and global security issue, and it certainly requires a whole of society, multi-sectoral, and equitable approach. I'll just close with a quote from the UN Women's Policy Brief on the impact of COVID-19 on women, where they said, "While women will be the hardest hit by this pandemic, they will also be the backbone of recovery in communities, and every policy response that recognizes this will be more impactful." So I'll close there and hand it back to you, Dr. Klugman. Thank you.
Thank you, Major Effler. And I think the important ways in which you laid out the links to gender inequality and the importance for health security, as well as the role of women and addressing gender gaps in recovery, are all important points that we'll be taking up in the discussion ahead. Let me turn now to the second speaker, Dr. Erin Huey, who's the Director of Global Operations at the Pacific Disaster Center. She's dedicated her academic and professional career towards advancing evidence-based practices. Most recently, Erin led a global women, peace and security analysis for the US Department of Defense to identify the drivers of inequality and areas for potential DoD investment to promote empowerment. Dr. Huey holds a PhD in geography with a focus on natural technological hazards and health. Dr. Huey, I understand you'll be bringing in the experience of several countries in the region that are currently experiencing very high rates of infection in the context of your recent analysis for DoD. And we look forward to hearing from you now. Thank you.
Thank you, and aloha, everyone. Can I get a confirmation that you can hear me and see my screen? Okay, excellent. Well, thank you so much for being here. Since we are short on time, I'm going to make a few selected highlights and comments so that we can have an open discussion. But I think here today we all understand and we're very much aware that the Indo-Pacific region has some of the highest COVID-19 cases globally, and that these challenges are just deepening the pre-existing inequality. And our focus must be on mainstreaming women, peace, and security into every conversation that we have. There is no issue that is not a gender issue. And to have that perspective and to actively integrate a gender perspective into each of our decision making, it requires data. And that's not really an exciting topic for a lot of people, but it is the backbone for policy changes and the development of new practices. So I'm going to highlight just today a few items. Part of the assessment that we've done is one that not only looks at gender empowerment and gender inequality, which is traditional in our view, but also includes exposure. And that exposure could be many things. That exposure could be COVID-19, that could be a typhoon or a tsunami, it could be conflict, it could be maritime security. All of these are of real importance to our partner nations and to our security forces, which is why we wanted to bring together and be able to use a scientific approach to really evaluate women, peace, and security responsiveness. Because what we know is that your ability to absorb any type of impact, COVID or hurricane, for example, typhoon, will depend on, in many ways, the empowerment of women and the inequalities that we see. So I'm going to just highlight for a few few things that you might find interesting. So just for the Pacific region, for the Indo-Pacific region, we are actually lower in government participation, in security capacity, and in gender-based violence. That's based on the data. And building on some of Major Effler's comments, gender-based violence we know is exacerbated during times of global pandemic and isolation. We also know that lack of participation in government and in decision-making will mean that women's needs and requirements are underrepresented, which means that the policy and the recovery will be short-sighted. And of course, with the security capacity and a lack of understanding of unique gender requirements can also continue to exacerbate those. So just to share a little bit of the highlights, what we're looking at here is overall gender responsiveness. So this includes exposure to any type of impact. We calculated here things like climate change and conflict, non-state malign actors, just to mention a few. And those countries that had very low responsiveness also tended to have very high levels of inequality. Sorry, but a little bit of, there's a delay, my apologies. So inequality. So we're seeing things like, you're seeing very high inequality in places like, I'm sorry, my screen is jumping, in Nepal and elsewhere. So I'm going to just take you quickly to highlight a few countries and talk about why the data is very important. So what I did here is pulled out a handful of countries that are seeing some of the highest COVID cases. They also tend to have fairly high gender inequality scores, but that doesn't tell us all the story. When we start to look at case fatality rates, those that have higher gender inequality also tend to have higher case fatality rates. They also tend to have year-over-year loss in total working hours. Now, that number in itself on the loss of total working hours really needs to be disaggregated. And that is one of our pushes, understanding the parity or lack of parity that exists between men and women in these areas. So just to give you an idea, we have over a 17% loss in total working hours due to COVID-19 in Nepal. They have a high gender inequality and fairly high case fatality rates. What makes it worse is that Nepal also lacks the engagement of women. So for example, on their government 7-member COVID-19 crisis management center, there are 0 women participating in that decision-making. In the Philippines, we also see that there are no women on the COVID-19 task force, and only 4 of 24 major department heads are headed by women, which means there is a lack of gender perspective and diversity in the decision-making. I think we all are aware of this, but the data is what helps us to craft the story and ensure that as we move forward, that not only can we change the perspective so that COVID, which is deepening those pre-existing gender inequalities, that we can put a pause on that. We can't necessarily turn it around overnight, but let's make sure it's not getting any worse. Also helping to ensure that the women that are the operational response, they are on the front lines, are also the same people that are in the decision-making. They're in the room to support the decision-making. And just the third point that I want to note is that there is no way for us to successfully advance COVID-19 recovery without first understanding and meeting the needs of women, girls, and gender minorities. And this really should be at the forefront of our policy, of our decision-making. And to do that, we should do that with clear data. So keeping in mind our time, I'll pause there and look forward to hearing from the other speakers.
Thanks so much, Erin. That was great. And I think that we will have hopefully about 15 minutes or so for questions and discussion. So we look forward to picking up some of these points in the final part of the session. But moving right along, I'd like to welcome Mr. Troy Stangeron, who's Senior Director and Fellow at the Korean Economic Institute of America. At KEI, he focuses on US-Korea relations, South Korea's foreign and economic policy, as well as North Korea. In addition to his work at KEI, he's an active journalist, a columnist for the Korea Times, and a contributing author for The Diplomat. Prior to joining KEI, he worked on Capitol Hill and holds an MSc in International Relations from the LSE. Mr. Stangeron, I understand you're going to focus on the experience of South Korea, and we look forward to hearing from you. The floor is yours. Thank you.
Thank you, Dr. Klugeman, and I'll try to be as quick as I can as well and take a few things out. I'm delighted to be here today to talk about how the pandemic has impacted gender equality in South Korea. As I'm sure many of you know, South Korea is the world's 10th largest economy and a technologically advanced country. It is home to leading international firms such as Samsung, Hyundai, and LG. And you may recall earlier last year, during the pandemic, South Korea was reported to be one of the first countries to develop a test for COVID-19 using artificial intelligence. However, with all of South Korea's advances since the Korean War, how has the pandemic actually impacted gender inequality in South Korea? And what I'd like to do is to begin with a couple of slides briefly and talk somewhat about the current state of gender inequality in South Korea. And so if we take and look at these two OECD graphs in terms that show tertiary education in South Korea, what I think you'll notice is that South Korea is on the far right-hand side, the two red dots. The square dot or diamond is individuals between the ages of 55 and 64. The circle up top are individuals in the age brackets of 25 to 34. As you can see, South Koreans are highly educated, especially younger South Koreans. And there's a significant gap, though, between the population in the younger age bracket as opposed to those towards the end of their working careers. Now, however, if we take and look at the 25 to 34 and we break it down by gender, in this graph, the circle are male South Koreans, the diamond is South Korean women. And as you can see, South Korean women within the younger age group are actually more educated than South Korean men, and perhaps the most, well, within the OECD at least, the most educated group amongst those between 25 and 34 amongst all OECD countries. So we're talking about a country that's highly educated and its youth is extremely well educated. Now, how does this play out though in terms of gender equality within South Korea? If we look at the World Economic Forum's most recent gender gap report, South Korea ranks 108th overall, so towards the bottom. In terms of economic participation and economic opportunity, it ranks 127th. If we look at OECD data on gender pay gap, South Korea is at 35.9%, while the OECD average is only 12.8%. Just today, the Ministry of Gender Equality and Family released a new report that notes that males in South Korea in listed South Korean companies, so those on the stock market, earn 1.6 times what their female colleagues do. According to that same report, the gap is largest in business facilities and financial services, while arts, sports, and the energy sector actually have the lowest gaps in terms of pay. Public institutions also have a pay gap, and it's 27.8%. So even within the public sector, there's still a fairly significant pay gap for women in South Korea. If we return to the World Economic Forum's data, in terms of educational attainment, South Korea ranks 101st, but I think, and one of the reasons I wanted to show the OECD graph is that this is largely explained by the gap in educational attainment by age. And so I think as we move forward, that's something that's probably going to change significantly as South Koreans age over time. If we look though, Korea is also tied for first for health and survival. And this is the good news for South Korea. South Korean women have amongst the highest or life expectancies in the world, and are seeing gains that over time will actually give them the highest life expectancy in the world. However, for political empowerment, South Korea ranked 79th. Only about 17% or so of the National Assembly members are female. Women also do the most unpaid work. They do about 215 minutes of unpaid work according to the OECD per day, while men do about 49 minutes. So with that in mind, how has the pandemic really played out for women in South Korea? And I think if we look at this directly, they have borne the brunt of the economic costs of the pandemic. If we look back to data in January, about the beginning of the year and 1 year into the pandemic, unemployment was only 5.7% in South Korea, but for women, it was 6.7%. About 867,000 South Koreans had become economically inactive during that first year of the pandemic. However, 476,000 of them were women. Now, one of the challenges that women face is that they tend to be in jobs that have less employment protection. Korea has a fairly high level of temporary employment. It's 24.4% of the labor force, which is significantly higher than the OECD average. And women account for 63.5% of that part-time labor force. And for men specifically, part-time jobs only account for 8.9% of all jobs that men hold. Not only were women's jobs more likely to have fewer protections, but they also constituted a large percentage of employment in industries that were most impacted by the pandemic. So if we think about things that require social distancing or that were impacted by travel, restaurants, hotels, retail, these types of industries are where women were often the predominant employees. Now, as the economy has improved through this year, we should note South Korea has performed economically better than virtually all countries other than China from an economic standpoint. We have seen more women join the labor force or rejoin. But in the most recent data in July, despite the female labor force participation rate having gone back up to about 54% from 51.8% in January, it actually declined by 0.4% from the month before in June. And if we look at this more directly, in July, you saw South Korea once again implement stricter social distancing regulations. And if you look at the specific data by industry, the part of the economy that lost the most jobs were once again in those areas with things like hotels, restaurants, and retail. South Korean females also have seen their employment, while perhaps come close to pre-pandemic levels, many of those jobs remain at risk due to the pandemic and potential future variants that might require additional social distancing. Women have also played an outside role, however, in South Korea, and we've heard this mentioned previously, in fighting the pandemic. While only 25% of doctors in South Korea are female, women account for the vast majority of workers in health and social work activities. Specifically in the healthcare sector, 94% of paid healthcare workers are women. South Korea's efforts at tracking and tracing have helped to manage the spread of COVID-19 domestically and avert the levels of deaths that we've seen in many developed nations. Based on the most recent data from Johns Hopkins COVID-19 dashboard, we see 2,303 deaths from COVID-19 in South Korea. Now, while not all countries report deaths by gender, the broader trend globally seems to be that the mortality rate for men is greater than women for COVID-19. However, based on the latest data from South Korea, women are slightly more likely to die from COVID-19 than men. It's about 50.18 to 49. So very close, but still slightly higher. The burden on women in the home has also increased. According to a survey by the Korea Labor Institute at the beginning of the pandemic, 56.3% of South Korean women reported an increase in their work related to taking care of family from the pandemic, and 62.1% of South Koreans also that took leave were women at the beginning of the pandemic. Additionally, the survey found that 33.5% of women said that they were the only ones to do household work in their household, while 17.2% said that their household work had increased by an average of 2 to 4 hours a day. So I want to also try and tie together sort of why gender inequality impacts national security in South Korea. So if we look at this from an economic perspective, simply put, it makes South Korea poorer than it would be otherwise. The female labor force participation rate is about 19% behind the male labor force participation rate, but South Korea also has a declining population and workforce. Prior to the pandemic, the IMF estimated that if the female labor force participation rate continued to grow at the rate it had in the decade prior to the report, women would contribute less to GDP than they do today by 2035 because of population decline. However, if that participation rate could reach the rate of the male labor force by 2035, South Korea could add 7% to GDP. So what does that actually equal to, or what does that mean? South Korea spends about 7% of GDP on healthcare, or to put it in national security terms, that is more than twice what South Korea currently spends on military expenditures. However, this isn't simply an economic issue and the amount of resources South Korea has for its own national defense. This is also a workforce issue and a personnel issue for the military. South Korea's military is currently a conscription force, but over the next 2 decades, declining birth rates mean that there will be too few males to man the military at its current force levels. For the United States, around 14% of our military personnel are female, but for South Korea, the number is only 6.8. So without significant military reforms or greater integration into the military, South Korea simply will not have the personnel it needs to take and man the military. And so not only are women taking and providing a significant part of the economic costs of COVID-19, are they not the ones at the front lines for COVID-19 and dealing with the healthcare issues and at home, but they're also a very important part of the economy and the national defense. And if they're not better integrated into the South Korean economy, the South Korean workforce, and the South Korean military, there are significant national security implications in the years ahead for South Korea. Thank you. I look forward to the discussion.
Great, thanks, Troy. We've certainly had a very rich set of presentations, but let me turn now to welcome Dr. Sharmila Parmanand, who's Gender and Human Rights Teaching Fellow at the London School of Economics and Political Science. She has a PhD from Cambridge University and focuses on migration, gender, and populism. And she has a very interesting presentation today looking at the securitization of pandemic responses in the region with a focus on Southeast Asia. So Sharmila, over to you.
Thank you. I will now share my screen. Hi, everyone. Good evening from the UK. All right. So given that we have limited time, I've modified the presentation a bit to just treat the Philippines as a case study, although some of the features here are also evident in Thailand and Malaysia. So I'll do 3 things in this presentation. 1, just sketch out what a securitized approach looks like to the pandemic. 2, walk us through what the problem is represented to be, how the problem is understood if the solution is a securitized one. And finally, talk about the gendered implications, including on security-focused issues. So my background is I am a feminist IR scholar. I look carefully at language. I look carefully at how things are framed in public discourse. So a securitized approach to the pandemic in the Philippines is characterized by broad declarations of emergency powers for the executive, many military checkpoints, curfews, one after the other lockdowns, closed borders internally and externally, and restrictions on citizens' movement and speech. And we've seen the restrictions on movement and speech also happen in Malaysia and Thailand. And in a lot of these policies, the measures for social protection and workers' rights are underspecified, while the security-focused and punitive-focused measures are actually overspecified. There is also a lack of a data-driven approach to public health, so not much planning going into contact tracing or vaccine deployment or vaccine acquisition, not much support for the healthcare system, and the situation in the Philippines is consistent with what the previous speakers have already discussed about the healthcare system being quite feminized, actually. And so women are bearing the brunt of that lack of support. There are central roles for the police, for key police and military officials in the planning process and in the implementation of pandemic policies, even over health-related and health-focused or education-focused portfolios. And obviously, the leadership structure is disproportionately male. So while women might be at the front lines of the delivery, again, echoing what previous speakers have said, they are generally excluded from leadership and decision-making roles, and especially from this like elite security establishment. And as I've said, there's a strong focus on punitive measures. So at one point, 2 months into the pandemic, the Philippines was racking up more arrests than COVID tests of curfew violations. So what is the problem represented to be when it's a securitized perspective? So there's a lot of military metaphors that are being used. The war on COVID, the invisible enemy. It's not really very invisible because some of the enemy is lack of investment in the healthcare infrastructure. Metaphors of sacrifice, for example, being used quite widespreadly. So health workers being portrayed as heroes and martyrs is pretty common in the Philippines, I think globally, and the leader as a protector and dissenters as threats to public safety. And so the problem is really framed as a security challenge and an opportunity to expand police powers, and largely framed as a lack of compliance, which then allows leadership to demand obedience and discipline. There's a lot of focus as well on strong bodies and shaming individuals who contracted the illness as though it is their fault, and individual resilience, which then shifts the responsibility for self-preservation to citizens. And again, we've discussed how women already bear disproportionate burdens in this context. This was also a political moment that allowed for the Duterte regime to enact laws that criminalize fake news, and a lot of arrests were made under this new law, and an anti-terrorism law that guaranteed the executive strong powers with very little judicial oversight. So that's what's happening. What are the gendered implications here? Under these kinds of lockdown situations with very weak support for the healthcare infrastructure, women's economic and unpaid care work burdens have increased. So it's exacerbated by lack of attention to children's welfare, and the constant lockdowns has meant online schooling. Schooling is the norm currently, which means again more burdens on mothers. Lack of access to contraception and reproductive health services, so unwanted pregnancies have increased. Women disproportionately affected by the shrinking informal labor sector as well, because we have a huge population of informal workers in the Philippines, heavily feminized, and the closure of small and medium enterprises. Increased exposure to intimate partner violence, partly because of lockdown situation, but also huge restrictions on mobility and transport. And the shelter and support services have been massively scaled back. So local governments have had to prioritize like immediate relief and aid delivery. So even when women get to a point where they're able to report these things, they're just turned away because there's no capacity. Increased vulnerability to abuse and harassment in border checks. So the military checkpoints that are there to enforce curfews and lockdowns, even when people like need to go out to buy food, for example, usually include like temperature checks and physical screening, right? And there's been increase in the number of women reporting having been subjected to assault or harassment. An identified increase in the risk of child marriage due to economic pressure, Indigenous women being restricted from accessing farmlands, which is essential for economic security, or LGBT families not being eligible for relief aid or not being counted as a household and therefore not just not being tracked. There are also other gendered implications in terms of restrictions on women's rights defenders' ability to protest, which incidentally coincides with a spike in gender-based violence, so that makes things even worse. In the context of the conflict-affected areas in southern Philippines, socioeconomic initiatives were always mitigatory. They were never like the focus. But that's become even worse under the pandemic because a lot of these programs had to be paused or discontinued. Greater food insecurity for women because there's already limited food supply in conflict-affected areas, and women tend to be the ones to say, okay, let's give that to our kids. And there's been an increased presence of the military near evacuation centers and residential areas because they're trying to implement lockdown policies and curfews. But their presence there makes them more likely to be targeted by armed groups, which then means a spillover violence on the civilian population. There's a big risk of undermining the momentum of women peace builders and women's participation in the peace process and planning. So the Philippines actually has pretty intricate plans and global best practices when it comes to incorporating women in leadership roles in the peace process. But that is at risk on the ground by virtue of the pandemic situation and the securitized response. Orphans and widows aren't being properly counted in conflict situations, which affects their access to support and services, and the hygiene and health needs of women in evacuation centers and displaced communities are currently being neglected. I mean, there are also signs of hope. Civil society has mobilized around putting together a citizens budget tracker, and that's been cited as a best practice by the Asian Development Bank, where they, because budget making processes are very opaque, and so they've insisted that it needs to be more participatory and people need to have a stake in it. So they've managed to petition government agencies for information and cobble together what they can to track what's being spent on what and to call out corruption where it does exist. And that, it's a modest success. I wouldn't call it a resounding success yet, but it is quite promising. All right, I'll stop here because that's 9 minutes. Thank you.
Thanks so much, Sharmila, for reminding us of some of the retrogressions that we've seen in terms of responses associated with the pandemic. We've covered an enormous amount of ground in the 40 minutes so far. We have a bit less than 20 minutes left together, and we'd like to dive more deeply in the Q&A and discussion. Please do pursue the options that you have for asking questions or making comments in the audience. I know that we have a large audience online. You can either type it into the Q&A by way of reminder and click send. Alternatively, you can use the raise your hand function if you'd like to ask your question verbally, and I'll do my best to call on you, time permitting. And of course, if your question is directed to a particular speaker, do let us know. So far, I've seen one question in the chat, so I'll share that with the panel now, together with a couple of broader questions to help kick off the discussion. The first, which I think is a good one, and more forward-looking, is whether or not COVID provides an opportunity to support WPS initiatives as we build back economies and systems around the world. And relatedly, I know that there's clearly kind of major problems and concerning amplifications of gender inequality in much of the world. But I would like to kind of throw it back to the panelists and ask you to share one or two examples of good practice. It may be modest in terms of success, as Sharmila said, but signs that the governments and others are taking actions to avoid worsening gender inequality in the face of the pandemic. You might also highlight aspects that best be avoided. And then secondly, I just wanted to put back on the table, and also linking to the good session we had yesterday about civil society and women's groups, whether or not you could share examples of engagement of civil society and women's groups in advocacy or in implementation, again, with examples of success. Sharmila mentioned budget tracking as one example. But if you have others to share, those would be most welcome. So let me turn back to the panel. I guess I could do it in order. It might be easiest. Camille, do you have points you'd like to share? And then we'll go to Erin, Troy, and back to Sharmila, and then I'll let you know what's coming on the Q&A. But Camille, over to you, or back to you. Thank you.
All right, thank you. So I think just touching on does COVID provide an opportunity to support WPS initiatives? I certainly think so. I think if not now, when, to make some of these gains, particularly in the health sector, especially, just going back to recognizing that, the bulk of healthcare really is delivered by women, and yet they are really not in the decision-making table, and that's across the board from the bottom to the top. And I think there's so many women's organizations at all levels, from grassroots to high-level strategic policy, that have put out kind of asks and kind of a way forward. And so I really, I think the blueprint is there, and certainly we have a lot of, ground to cover. But I think the work that Dr. Hughley's doing and things that are actually pulling the data, that's what we're going to need to really move forward and make sure that we're targeting our interventions. And then as far as an example of something, I was kind of just going through the literature and came across the Gender and Humanitarian Action Working Group actually conducted an analysis of 20 humanitarian and multi-sectoral plans in response to COVID across the Asia-Pacific region. And kind of a good news is they found that 2/3 of those plans actually included components of GBV prevention and response, and more than half included components of our elements of sexual and reproductive health. So certainly, at least we're seeing some of these things make it into the plans, and I think 2/3 is good. Now are those going to be resourced and carried out? That's the next step. But certainly, I thought that was a good news story, and I'll stop there. Thank you.
Great, thanks, Erin.
Yes, thank you. So I too want to start with the question of, does COVID provide us with an opportunity to engage and integrate women, peace, and security? And I think that's a resounding yes. I think any problem that we need to tackle, we should be integrating women, peace, and security. But just off the top, there are elements of work that the U.S. and partner nation militaries are undertaking, whether that's in the humanitarian assistance, in response to disasters, whether that's some of the medical readiness efforts or medical subject matter expert exchanges. By integrating an element that focuses on, one, making sure that you've got women in the decision-making and crafting of the engagements is critical, but then also making sure that we're leveraging the data to target certain areas. So if you're going into a partner nation or you're supporting a partner nation, what are the drivers there? Do we see women have very low access to healthcare? Then are we getting out to the geographic areas where women are located? Are we making efforts to ensure that there's transportation? In many small ways, every program that we're advancing to support security can and should integrate women. And I think it can be done in very, very tangible ways. And then also in the education component, right? As we integrate more actively women, peace, and security into the curriculum of regional security centers, that allows us to conceptualize problems that have traditionally had a male lens in a new way. And so I was really excited to hear what Shamila was saying, and the evaluation of the actual language that's being used. So I think that's one. The last point that I want to say, as far as a success story, I think we underestimate the military and their power of cultural change. And we really have an opportunity when we're engaging with the military and security forces to share with partner nations how the US is approaching women, peace, and security at the highest levels of leadership. Because often what the data has shown us is that we're seeing an increase in women in the security sector and in security forces before we see an overall increase in women's empowerment in general society. So I think the role that women and women in the military can play is really significant and shouldn't be underestimated. I'll pass it now over to Troy. Thank you.
Well, thank you. I think, from looking at the South Korean case specifically, that it's also an opportunity. The pandemic has highlighted a lot of not just the structural challenges that women face, but the broader structural challenges within South Korean society. And so I think this is a good chance for South Koreans to reflect on those and try to find a way forward. I think there's a couple interesting things to me about South Korea. One, when you start looking on the government side, there has been over recent years a greater effort to bring women into government service. Many of them now are at the lower or mid levels within the foreign ministry and other ministries. And I think the real question is going to be, as they start getting to the point to where they're promoted into the higher level positions, do we start seeing a much more equal balance there or not? So this is more of like a long-term perspective. But when we look specifically at some of the things that Korea has done on the economic side within the pandemic, they've not specifically been designed to address the needs of women, but in a way they might be beneficial regardless, despite not being directed specifically there. South Korea has done two things that I think are relatively unique in terms of trying to take a deal with the pandemic. One is it sent out multiple rounds of stimulus, and it's over time targeted those to where they only go to those in most need. So you're starting to see it narrow down to the people who have lost employment or who are on lower ends of employment. So this is going to, by nature, end up impacting women a lot more than it's going to impact men in society who have higher salaries or better or higher, more job employment. The other thing that they've done, and it was actually very interesting, is to where, we had our small business loans and there were all kinds of problems and everything, but South Korea actually spent a lot of time and effort trying to make sure that small businesses survive. And one of the things I think we often don't realize about any economy is that the major companies often employ about 5-10% of the population at most. Most people actually work for a small or medium-sized enterprise. And so I think this is a really important thing to try and take and focus on. And so after the pandemic, I do think there probably needs to be a review of how South Korea's programs work to see if it was effective and how that then impacted, women's ability to either stay in the workforce, keep their businesses open, or to rejoin the workforce quickly, because those are going to be key points going forward. The one last thing I would say briefly, I mentioned the Gender Equality Ministry's new study. This is something that's first time this year, but it's something that South Korea is trying to do, which is in essence a name and shame to point out where the inequalities are in the hopes that that will take and lead companies and others to take and start being more equitable in the long run.
Yeah, I'm also cautiously optimistic. And my reason for this is because I do think the pandemic has made very visible that governance approaches that, are very heavy-handed or are super dismissive of data, for example, do not work. And that governance approaches that foreground health expertise, more compassionate, more caring approaches seem to be, at least as far as we can tell, a bit more successful in minimizing suffering and increasing chances of recovery. So it feels like a learning moment that we can leverage. Some examples in the Philippines, again, very, very early stages. This seems to have given rise to like an emerging consensus that we do need gender training for security forces and police, and that we need more women in positions of power. So that's kind of consistent with what Erin was saying. Now, I don't know, if this will actually happen under this regime, but at least there is that recognition. It's entered the sphere of public discourse. The second is that we've managed to identify that there are massive information gaps in certain sectors of society in terms of like what services are available, how to access them, and how to report corruption. And we've seen like an emergence of very different models run by civil society organizations or academia of hotlines, human and AI chatbots that simulate conversations with people and deliver like real-time assistance about their questions and concerns about government social welfare programs, or providing feedback on their experience of these programs. the Philippines, despite a huge poverty levels, actually has very high internet and cell phone penetration rate. So that's something that people are making use of, and women in particular really benefit from this. So that's quite interesting to watch.
Thank you. And thanks again to all of our panelists and to the organizers of this important conference. Let me just try and sum up what's been a very rich discussion with a couple of key takeaways. I think the first and very central theme has been that the crisis, the pandemic, has exposed existing gaps and often worsened those disparities. It's underscored the urgent need to build equitable systems that are resilient in good times and bad. At the same time, the crisis has brought some welcome innovations and innovations that recognize and address existing inequalities. And it's of course important that policy responses do take into account pre-existing disadvantages and ensure that no one's left behind. An important theme associated with the discussion is the inclusion of women in decision-making, which is often not the case. And then finally, not least, a recurring theme is the importance of data and evidence. We need more evidence about service gaps, for example, as well as evidence about what works and doesn't work. So even if a number of responses do appear to have been well conceived and designed, and therefore can be seen as promising, there's an urgent need for more evidence to inform about whether or not those innovations have indeed been effective. So back to you, Ariel, and thanks again for your patience and looking forward to the final very important session. Thank you.